Welcome back to the Awesome Physio YouTube channel. Today we are looking at why am I getting pain around the front of my knee. So there are lots of different causes or conditions that can trigger pain around the front of the knee. So we are going to break down some of the top conditions that we see in clinic. So there are lots of different conditions that can trigger pain around the front of the kneecap. So we're going to be breaking down the top ones that we see in clinic. So number one, we're going to be looking at patellofemoral pain syndrome. So what that fancy word means is that it's triggering pain, signs and symptoms around the front and around that kneecap. So what we want to look at initially when someone comes into clinic is we want to be able to differentiate this from other conditions. So a couple of other conditions that can look very similar to this area is chondromalacia patellar, which is wear and tear of the articular cartilage underneath the kneecap, or a patellar tendinopathy, which is aggravation of the lower tendon below the kneecap. So what differentiates patellofemoral pain syndrome is more of a vague pain, a dull ache around that kneecap area, typically not due to trauma. It is normally due to either an insidious onset, so coming on for no apparent reason, or it could be linked to an overuse injury where we've changed what we've been doing, either frequency, intensity or duration, that's triggered pain and soreness around that kneecap. So what's actually triggering the pain around that kneecap? So when we think about the kneecap, it's called a sesamoid bone. So what that means, it sits within muscles. So if there's any abnormal tightness or pain into the quadriceps muscles as they come down and blend around the kneecap, that can pull the kneecap into abnormal positions, causing pain and soreness around that area. How someone presents is typically something called Theatre's sign. So when they're sat for a long period of time, it can start to get achy around the knee. They create a circle sign, which is that circular motion around the kneecap. They normally explain it as like a dull ache or a really deep soreness into that area. And what we would look at when testing is we would look at the knee mechanics, how it's moving, when we take it into full flexion and extension of the knee, how it feels, and most importantly actually pushing and palpating around that kneecap to see if there's any points of tension and tightness that might be impacting the movement, the biomechanics of the knee, that might predispose that patellofemoral pain syndrome. The next condition that's very common that we might see in clinic is a patellar tendinopathy, so an infrapatellar tendinopathy. So what that means is where the quadriceps come together, they blend around the kneecap. It's the tendon that attaches below the kneecap that can become damaged. What people typically report is localized sharp pain below the kneecap. It's normally come on from either trauma, if they've had an impact into the knee, or more commonly from that overuse repetitive movement. So what kind of sports, what kind of repetitive motions and movements can trigger a patellar tendinopathy? So it's normally quite high impact sports, or any kicking or anything repetitive like cycling. So what we want to think about with the patellar tendinopathy is what is the function of that tendon and the muscle belly. So your quadriceps, which blend into that tendon, its role is to extend the leg. So you're straightening out the leg. So anything where you're repetitively doing that over time, and we're loading and maybe we're contracting through the quadriceps muscles and we're not stretching them out, can start to aggravate or damage into that tendon. There's 3 stages of the tendon injury. So we have that reactive phase where it's really, really sore, a little bit swollen, a little bit tender over the tendon where it's just come on. We then get that tendon disrepair, that mishmash as that tendon is repairing, which can then lead to a degenerative tendinopathy. So you can see how it can either build up over time or can come on quite suddenly in terms of pain. What we want to look at is assessing is when we resist or we ask the person to activate their quadriceps, does that cause pain underneath the kneecap? When they're walking, what is the mechanics of the hip, knee and ankle that might be influencing how that tendon's working? We then want to look at and see how it is into the muscle bellies if we need to reduce any tightness, and then create a long-term treatment plan and rehab solution to get them back using the quadriceps where it's not firing into that tendon. Next, we are looking at pes anserine bursitis. So this is when one of the bursa, so the sac of fluid around the knee, starts to inflame and become incredibly sore. So your pes anserine bursa is located on the medial side, so the inner side of the tibia, superficial to the medial collateral ligament. It is influenced by three tendons: your pes anserine tendons, your gracilis, sartorius, semitendinosus. Your gracilis and sartorius muscles work to adduct the leg to bring the leg in, and your semitendinosus muscle and tendon is related to one of the hamstrings, so it's one of the hamstrings, one of the three hamstrings, and its role is to bend the knee. So what happens if it gets really tight in those muscle bellies and the tendon is pulled as they blend together on that medial inner side of the knee? It can cause this bursa to inflame and become incredibly sore. What people will report is localized sharpness and pain over that area, worse when they're moving and using the leg. So what causes pes anserine bursitis? It can either be from direct trauma, causing everything to swell, causing inflammation of that bursa, or more commonly, which is what we see in clinic, is someone doing something repetitively over time, that overuse injury. So what it can either be is you've changed your frequency, intensity, or duration of your activity, or you're doing something that you would normally do, but where it's been building up over time, we're not stretching out those muscles and the tendons around that leg area, so we're not stretching out the leg muscles, causing excessive pressure, which might trigger inflammation and soreness into that bursa. So what would we look at in clinic? So first we want to take down that swelling, so recommendation of icing to reduce that swelling over that bursa, and then more importantly we want to work out, well, why has it come on? What's triggered this in the first place? Do we need to look at how someone's moving into the hip, knee and ankle, into the lower limb, lower extremity mechanics, or do we need to look at adding in additional stretching and release after they're doing their chosen activity? Finally, we want to talk about knee osteoarthritis. So we see a huge number of individuals coming into our clinics diagnosed or indicating signs of knee osteoarthritis. So the reason why it can be quite hard to diagnose, particularly in the early stages, is it goes from mild to severe. So sometimes what people are presenting with is just a little bit of stiffness and soreness into the knee, but it's normally as we go into the later stages where it becomes more and more degenerative, that's where the more severe symptoms are seen. So what someone would report is definitely a daily pattern of stiffness. So first thing in the morning, end of the day, it tends to feel really stiff into the knee. Typically the more they move, the better that feels. What they also report is possibly a change in how they're loading through the knee. So they might be avoiding weight bearing in that knee. They might be having a slight rotation or an abnormal position of the knee so that they're avoiding that loading of bone on bone. What typically finds is we might have a thickness on the medial side of the knee, so the medial joint line. Typically due to the mechanics of the knee, we tend to put more pressure through that side. So someone might report a deep dull ache inside the knee, stiffness and an ache around that area. What they also report is when they're going from seated to standing, standing to sitting, sometimes that can be really uncomfortable moving through the knee. And so people present with a variety of different symptoms. What's also really common with knee osteoarthritis is the surrounding musculature also becomes quite tender. So you think if you've worn down the articular cartilage and the bony surfaces and it's becoming really uncomfortable to weight bear through that area, your body is going to work as hard as it can to help you to continue to move. So what we typically see in clinic is that there might be tightness around the kneecap, there might be an overlap with the other conditions that we've spoken about already, or even tightness and pain slightly higher through that hip where someone's changing how they move. So what's really important if you're thinking that this might be what you're struggling with is having it assessed by a musculoskeletal expert who will be able to assess your knee, look at your movement, and would refer potentially for an x-ray if they needed that more detailed image of what's going on with the knee to find the best treatment plan and exercises if relevant for you.